Whenever you're ready.
Okay, we're gonna. Oh wait, do we have it pulled up here? Okay, so AIDS and HIV. AIDS is the acquired immunodeficiency disease, and then HIV is the human immunodeficiency virus, which both of these weaken the immune system, making you more susceptible to other diseases. And one nickname for this is commonly GRID, which is gay-related immune deficiency.
Yeah, so just before we begin, we need to clarify the fact that HIV and AIDS are not the same thing. So HIV is a disease that compromises your immune system, but after approximately 10 years, it then develops into AIDS. And doctors can usually tell when it's AIDS after two main factors. The first one being if your CD4 blood cell count, which is what AIDS actually does, it kills off those cells. If that reaches below 200 per centimeter of blood, then you have AIDS. Because in perspective, the healthy body has 1,000 CD4 cells per centimeter of blood. And another way you can actually tell is if you have an opportunistic disorder, which is kind of a disease that should not necessarily affect your immune system, but since your immune system is incredibly compromised, then problems arise. And so without HIV medicines, AIDS will kill you in an average of 3 years, but if you develop AIDS and an opportunistic disorder, then you will die in approximately 1 year.
Okay, so with the modes of transmission, so AIDS can be passed on from person to person through, usually it's typically through bodily fluids, including blood, rectal fluid, vaginal fluid, semen, or breast milk. And the most common ways are through the bodily fluids. And usually with blood, it's transmitted through blood transfusions on accident, and that's typically the way of transmission through kids. And one common way, is usually through kids. Sorry, I forgot what I was saying. Usually transmits through kids through blood transfusions. So the next thing is symptoms. So there's a lot of common symptoms of HIV and AIDS. Typically it starts with tiredness and weakness, a lot of cold and flu symptoms, and then it goes on further to you become more susceptible to other diseases, going on to jaundice, it gives you diarrhea, and lots of other common diseases.
Yikes, sorry. Next, so actually where did it originate? It originated in roughly West and Central Africa, most notably Ghana or Niger, and it actually came from chimpanzees. The reasoning behind this is during the 1980s, which when it first had its outbreak, you could see that there's a decline in African governments that were actually functioning as they should be, leading their citizens to actually go out and eat bushmeat, such as chimpanzees and monkeys. And so the reason HIV became a thing was because monkeys had SIV, which is simian immunodeficiency virus, which is HIV but in animals. And so by eating this meat, you actually got infected with this new mutated version, which was HIV. And so historically speaking, 3.1 million people died, and that was in 2004, but currently at the end of 2018, only 770,000 people died of AIDS. Oh yeah, so rates of AIDS infections and mortality in 2004 and 2018, both of which were somewhat outbreaks. So as you can see, it's actually a decline in both of them, but most notably in those who died rather than the infection rates. So in 2004, the infection rate was 40.9 million people globally, and then the death rate with that is 3.1 million people. However, in 2018, we managed to bring that number down with only 37.9 people infected with HIV and AIDS, and then a death rate of 770,000. So as you can see, it's actually a decrease in both, even though it's most notably seen in the death rates.
Okay, so this is the difference between people diagnosed with HIV in developing countries versus developed countries. So we couldn't find any specific information about all developed countries versus all developing countries. So we took two locations, for example. We took the US and we took South and West Africa. So in the US, let's start there. There are 0.2% of all adults in the US are diagnosed with HIV/AIDS, and that's a total of I think there are 14 people, 14% of all adults diagnosed, all adults with HIV/AIDS in the US do not know they actually have it. So then let's move on to West and South Africa. So in Africa, the total percent of people with HIV/AIDS around the globe, 63% of those come from West and South Africa. And one shocking statistic that I thought was really interesting is that 91% of all child cases that are HIV positive come from these areas in Africa. And also that there's actually 7% of all total adults in Africa have HIV or AIDS. So with the HIV testing rates and HIV people who have the disease, this rate has gone down a lot in recent years, and there are certain reasons for that. So one major reason is education. So people are now becoming more educated on how to prevent disease and how to treat it, rather than, because if you don't know how to prevent it, then there's no way of getting better. And then another very important way that these rates have been going down is medical testing and access to medical care, because a lot of people who have AIDS did not realize that they had AIDS before, and they ended up falling ill and eventually dying to disease. And now people are getting tested more often and are becoming more aware that they have the disease, and that enables them to treat it and make their life longer.
Okay, so we're talking about risk factors and then populations at risk. So first, with the risk factors, if you practice unsafe sex or if you have multiple sexual partners, your risk of HIV and thus AIDS actually increases, because as we all know, AIDS and HIV is transferred through bodily fluids, which Abby discussed earlier. But that also has to go with the idea if you already have an STD or an STI, since a lot of these symptoms are actually open sores on the mouth and other areas, they become gateways and doorways for the HIV virus to actually enter your bloodstream faster, and thus giving you the problem faster. So next, if you use IV drugs, and we're not talking about a saline drip, but rather more like illegal drugs such as heroin, if you share needles, the likelihood of you getting HIV also increases, because you are sharing needles with someone who may or may not be making as good as decisions as you are. And another one is, of course, which is not your fault, is if your mom is pregnant. With HIV and AIDS, you can actually pass it on to your child, both through breast milk as well as just blood in general. And because of this, a lot of kids end up having it if you are not given medicine when you are pregnant with your child. And then, of course, blood transfusions. While this isn't necessarily a problem within the United States and other developed nations, in developing nations, if you do not thoroughly check the blood, then you could be accidentally giving someone HIV or AIDS just based off of a transfusion. Now, for populations at risk, the male, gay, and bisexual community is also at risk, just because anal sex is the most prominent way that HIV is spread. And because of this, you can see that group of people being with higher rates statistically. You can also see Africa also has very high rates of this, both within the United States, as African Americans amount for the highest new HIV diagnoses, as well as those infected, but also the country as a whole. And the reasoning behind this is poverty, which leads to a lack of education, especially sex ed, as well as a lack of health care. It also has to do with discrimination, racism, fear, and of course homophobia.
Okay, so treatments and cures. So there is no known cure for HIV/AIDS. However, there are several treatments, and there is actually no vaccine that is currently developed for HIV or AIDS, although they are working on that. So there are several inhibitors that can slow the growth of HIV/AIDS in the body. And so one of the most important ones, or the most prevalent that's used a lot, is called the protease inhibitor, and that stops the disease. It can stop it later on as it's developed in the system, so it prevents replication of the virus in the body. Another one is it was called NRTI inhibitors, and they can stop the spread of the disease throughout the body in the early stages. And another one, lastly, there are fusion inhibitors, which is actually probably the most effective way of treatment for the disease, because it takes several different types of inhibitors and combines them all together in order to find the most effective and reliable way to treat the disease.
So ways we're currently stopping it, the first one being, this is Ryan White, and he actually got AIDS from a blood transfusion. So in developed countries, blood transfusions and actually sorting through and looking at the blood before you give it to someone is probably one of the best ways in order to reduce it, and especially for kids. Secondly, practice safe sex. Communicate with your partners and don't have a lot of sexual partners. This will also reduce your chances of HIV and AIDS, and it's actually a really popular way that we're reducing it. Like Abby said, we're actually using medicine to stop the replication of the HIV within the body, and that's becoming increasingly prominent both within the United States and Africa. And finally, circumcision. If you circumcise someone before they're born, then it actually reduces the chance of passing on HIV in for a heterosexual couple by 60%. And so a lot of African countries especially are starting to do this in order to reduce the disease.
Okay, so there are some methods that are currently being developed or have not been used too often, and the first one is vaccines. So scientists are still working on developing a vaccine. However, if they can in the future, it will be very useful in preventing it. And then another thing that's pictured are microbicides, which are products that have been developed, well, they're still in the work of developing, in which they're made with several bodily fluids in order to help prevent the spread of this disease.
Yeah, so our plan to stop this is actually doing what Botswana did in 2002. And so what Botswana did was they actually instituted clinics as well as gave away HIV and AIDS medication to everyone who needed it. And the problem with this, rather than actually going in through a governmental organization, is that we understand that Botswana is a very wealthy country as they have lots of diamond deposits, but they also have a functioning government. According to the United Nations, 47 out of the 54 African countries do not have stable governments, and they're actually on the scale for highly corrupt. And so we actually plan on doing this through UN AIDS. So we're going to be instituting clinics across Africa, most notably because they have very high rates, and then we're going to be dispersing drugs to those who need it. So as of right now, Botswana is living proof that this plan will work, as 95% of the people who need the medications are actually on the medications. And finally, to wrap up our presentation, World AIDS Day is on December 1st, and that is really good for donations as well as just bringing awareness. So, thank you.